We hope you enjoy these free video flashcards. Stay tuned to the end and you'll discover how to get more cards free. Welcome to Cardiac Video Flashcards. Please make sure you have reviewed the terms, conditions, and warnings at NCLEXreviewonline.com/warnings. Acute coronary syndrome. Does the patient have to be doing anything to bring on this pain? No. What happens in right-sided heart failure? What are the signs and symptoms? The blood is not moving forward into the lungs, so it backs up into the venous system. Signs and symptoms are distended neck veins, edema, enlarged organs, weight gain, and ascites. What is the sensitive indicator of heart failure? The BNP can be positive for heart failure when the chest x-ray doesn't indicate a problem. What is the normal myoglobin? Negative. The priority treatment of VFib. Defibrillation. Post-procedure care for permanent pacemakers. Monitor the incision, immobilize the arm, assist with passive ROM to prevent frozen shoulder, keep the patient from raising their arm higher than shoulder height. What's the position for the pulmonary edema patient? Why? Upright, legs down. This improves the cardiac output, promotes pooling of blood in the lower extremities, is a good thing in this case. Pre-procedure cardiac cath. Ask about allergies to iodine and shellfish. Check the kidney function. The MD may order Mucomist to protect the kidneys. Warn and reassure the patient about the hot shot, warm flushing feeling, and palpitations being normal. Client education for chronic stable angina. Avoid overeating, avoid caffeine and other stimulants, wait 2 hours after eating to exercise, avoid temperature extremes, avoid isometric exercises and weightlifting due to increased thoracic pressure, reduce stress, stop smoking, and lose weight. What is a Swan-Ganz catheter? A balloon flotation catheter that can be floated into the right side of the heart and pulmonary artery. It provides information to rapidly determine hemodynamic pressures, cardiac output, and provide access to mixed venous blood sampling. Bumetanide, action, and dose/rate. It promotes rapid fluid removal that can be IV push 1 to 2 milligrams over 1 to 2 minutes or continuous IV. ARBS action. Block angiotensin 11 receptors and cause a decrease in arterial resistance and decrease the blood pressure. Blocks aldosterone. It is standard practice that a heart failure patient will be sent home on blank and blank ACE inhibitor and a beta blocker, because these drugs in combination decrease the workload on the heart by preventing vasoconstriction, decreases the afterload. This increases the cardiac output and keeps the blood moving forward through the heart. Blank is dependent on an adequate cardiac output. Tissue perfusion. BNP secreted by blank when blank. The left ventricle when the volume and pressures in the heart are increased. What is loss of capture? What causes it? No contraction follows the stimulus, aka the ventricles are not responding. This could be because it's not programmed correctly, the electrodes are dislodged, or the battery is depleted. A low sodium diet. What's the action with heart failure? It decreases the preload. If a patient is on blank, turn it off blank before drawing a BNP. Necessitide, and you need to turn it off 2 hours before the draw. Priority nursing action for pulmonary edema. Administer high-flow O2, monitor the SpO2, and titrate to keep above 90%. Pulmonary edema usually occurs when? At night, when the patient goes to bed. Amiodarone is used for VFib and pulseless VTAC that are resistant to treatment and fast arrhythmias. Renew nitro tablets how often? Renew nitro spray how often? Tablets 3 to 5 months, spray 2 years. What position for a patient with chest pain? Why? Head up, because this decreases the workload on the heart and increased cardiac output. With pacemakers, always worry if the heart rate drops below blank. The set rate. Post-procedure cardiac cath. Watch the puncture site, femoral or brachial, for bleeding and hematoma. Assess the extremity distal to the puncture site, or the 5 Ps. Bed rest, flat, leg straight for 4 to 6 hours. Report pain ASAP. Acute coronary syndrome is also known as unstable angina. What electrolyte balance most increased risk of DIG toxicity? Hypokalemia. Cardiac output equals blank times blank. Heart rate times the stroke volume. Narrowed pulse pressure equals blank. Widened pulse pressure equals blank. Narrowed equals cardiac tamponade. Widened equals increased ICP. What is pulse pressure? Systolic minus the diastolic pressure. Beta blockers effects on the BP, pulse, myocardial contractility, and the workload of the heart. All of them decrease. Number one sign of MI in the elderly. Shortness of breath. A few different ways that you can get more free. The first is you can subscribe to our YouTube channel. When we get 100 subscribers, we'll release the next video. You can help us get more subscribers. You can copy the video link and post that link on your social media, Facebook, Twitter, Pinterest, etc. Comment on and like the video. You can also subscribe to our newsletter, like our Facebook page. If you go to NCLEXreviewonline.com, at the top of the page here, you can see the links to our different social media accounts. I want to thank you. I hope this has helped you some. We hope you have a great day.